Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. In this video, I'm going to share with you a commonly overlooked movement fault that leads to constant back and piriformis pain. I see this happen very often as it relates to many different activities in life. This movement fault shows up when you're sitting, when you're getting up from a seated position, you go to stand, when you're walking, when you're outside, when you're gardening, when you're cleaning the dishes, and so much more. And so take the concept that I'm going to share with you in this video, ask yourself, what do I have trouble with, and how might this be showing up for me, and apply some of the strategies that I'm about to share. And go ahead and try to change this movement fault and see if it allows you to feel less tightness, less tension, less pain in your back and or your butt. For those of you who don't know me, again, my name is Dr. Charlie Johnson. I'm a physical therapist. I'm a board specialty in orthopedics, and I help people all around the world with back, butt, and sciatica problems. Before we even begin, if you're curious as to the cause of your back, butt, or sciatica problem, be sure to click the link above to download my Better Than an MRI DIY diagnostic guide so you can figure out the most likely source of your symptoms for free. All right, so the most common movement fault that I see show up for people in life, usually in ways that they don't know, and that's the purpose of this video, is leading with your head, not with your hips. And so I'm going to recommend that you start to lead with your hips, not with your head, if you have trouble doing the things that I'm about to show you. And the reason that this movement fault becomes such an issue for many people is because it increases how hard your muscles have to work in your back, in your butt, because those things prevent you from falling forward. And well, if your head is the thing to lead while you're doing the activities I'm about to show, then your back muscles are working harder, your butt muscles are working harder to keep you upright. What happens when you squeeze or place tension through muscles for an extended or prolonged period of time? As you squeeze them, you reduce blood supply. If you reduce blood supply, then you reduce oxygen and nutrients to the area that is in pain and trying to heal. So keep that in mind. It's going to be a common thread throughout this video, so you can see all the positions you might be doing in everyday life that are increasing how hard your back and your butt muscles have to work. All right, so the first place leading with your head in front of your hips shows up is while you're walking. So this is going to be helpful for you as a way to become more aware of what's happening, and maybe something you can change if you have pain while you're walking. All right, so normal walking, we'll call it, for most folks, without pain, would be pretty darn upright. So if she pauses here, you can see that her head is in line with her hips. If I were to draw a line, there's very little muscular effort required of the back, some of the hips, but not too much. Now, over time, if we reverse this, you might notice that you're walking more hunched forward. Again, if you're not sure, ask a family member or a friend. And this just generally occurs with time. As we become a little bit more stiff, as we're more driven by a mission, something we have to get done, right? And so if we stop, right, why does this matter? You can see, bring your feet together, please. You can see that she's slightly bent forward. Again, her head is leading, not her hips, right? So she's not upright. And what that does is, you can imagine, try it if you have not already. If you just pitch yourself forward a little bit, what has to happen is that these back muscles have to work really hard to hold you up so you don't fall flat on your face. Same with the butt muscles. The action of these muscles on the back side of the spine and the glute muscles is to extend your hips and extend your spine. And so if you pitch forward, then these muscles are constantly turned on and working. And again, why does that matter? The harder these muscles work, the more they squeeze, they reduce blood supply, oxygen, and nutrients to an area that needs it and is trying to heal. All right, so are you leading with your head versus your hips? Because if you are, and if you're able, try to pull your hips forward. Again, this could just be a habit, and it's possible you could just change it, but you've got to be aware of it. Walk through the store, maybe look in the reflection. Stand in front of a mirror and see, are you slightly tilted forward, or ask someone for feedback to see what your alignment is. All right? It's not good or bad or anything like that, but it does make walking more difficult. All right? I recommend that you try to pull your hips forward and you walk maybe like you once did. All right? And again, that'll make it easier. That'll reduce the effort required to walk, shut off those muscles, and restore the blood supply to an area that's painful. All right, so that's the first area. This is helpful for you if you have pain while walking. Try leading with your hips, not your head. I see this happen every single day with people that I work with. And just by making that little tweak, we can see a massive reduction in pain. The second place where this shows up is getting out of a chair, where you're leading with your head rather than your hips. And many people with back pain, here's what getting up looks like for them. So they lean forward like normal, but they do this, they push up their knees, and then they extend back. So go ahead and do it again. We're going to exaggerate it for people. So go ahead, forward, straighten your knees, straighten your legs, push up, keep your back bent over, and then they're pushing up, or they're walking their hands up their thighs to get up. And you can see that if we slow-mo it, so go ahead, slow-mo it, get to that position where you're forward, stand up, stop, in order to stand up, she's really bent forward. What has to happen? She has to use her back muscles, again, which extend the spine, and she requires a lot of effort to stand on up tall. Again, more effort than is necessary versus, as you'll see here in the video in a moment, go ahead, take a seat. You could, again, nose over toes, and then attempt to pull the hips forward. So the focus becomes really driving the hips forward rather than pushing yourself up or pulling yourself up with the back muscles. So again, we want to lead with a hip push instead of leading with the head and then having to really kind of pull ourselves back using the back muscles. And here next, I'll show you a live case study of a woman named Bev who used this leading with the head, kind of pulling up strategy. And just by changing to a leading with the hip strategy, she was able to significantly reduce years of her back and butt tightness and pain. So I noticed this a little bit with you, and that's okay, but I'm just pointing this out. So there's two ways you can stand up. One's more efficient and generally requires less effort of your muscles, and the other one is a little bit less efficient. If it works for you, cool, but if you might want to try this on. So one way is that people, they hurt, so they kind of lean forward like this, and then they get their legs kind of straight, and then they go, "Argh."
Exactly what I do. Exactly.
Yeah, that's going to really work. These are the muscles then doing the work, everything up here to pull you up.
Right.
So you're basically doing a back bend to stand up. Does that make sense?
Mm-hmm.
And that's a yucky motion for you, right? Turning on those muscles. So what I would do is this. I think about being here, and now picture someone has a rope to me this way. So when you stand up, you can still lean forward like this, but my hips push into the ground and pull forward. I'm doing this.
Oh, wow. Okay. I don't know if I can do it. Oh, I don't know. Was that any better? Or
We'll try it. Let's see. Let's practice.
hang on. Yeah, I always bend forward.
Yeah, you're well trained, my friend.
I am well trained. I'm not sure how else to do it.
I'm not there, so I can't pull on anything. But the idea is that, right, your picture, like, I don't know, you had something on your belly here, or there was somebody had something attached to your belt buckle. And as you were standing up, right, like it's okay to stand up like this, but your hips come through, not your back lifting. Where does it hurt? Your legs or your back?
It's here.
Okay, your quads a little bit. Yeah.
I'm thinking it's just because my legs are weak.
Yeah, that seems to me more like it just you haven't used them like that in a while.
And that's why I have trouble going up the stairs. It's not so much those pains in my sciatica or whatever. It's not really that. It's just.
Do you have anything that you could like stand in front of to grab onto to practice? Like, for example, like countertop, or like even like some bands on a door frame, or I don't know.
Chair right here.
Yeah. Do you have something like that?
I do. Yeah, there where I'm at.
Yeah. That's your way of doing it.
Uh-huh.
You've been doing that for a while.
I have been, and I noticed I did it, but that's how I could get up. Okay, I'm gonna get this one here.
Now, obviously, don't pull the chair down, okay?
Don't what?
Don't pull the chair over on you, all right?
Yeah.
That'll be a blooper reel.
Yeah. Okay, I'm gonna get closer. I don't know. This is just not.
All right. We might need something more solid than the chair.
Or maybe something lower. No, I'm full. No.
Do you have? That's okay. What else do we have? We'll do one more thing. What do we got?
This lower. I don't know. This would be pushing up.
Yeah, that would be pushing up. Yeah, it's almost like, your countertops in your kitchen are too. How high are they? They'd probably be like it.
They probably.
It's not great. I'm trying to think if there's anything else.
Lower.
Probably higher, right? Because for example, your hips, the plane that your hips, you're trying to go this way, right? So when you put something lower, it's kind of like ugh, you're a little stuck, right? So I'd rather be higher, almost like you've ever seen at the gym, like where they have those straps, you know what I mean? Or like a bar or something, like almost like this actually. You have like almost like a, a column anywhere, right? Where you could hold on to, and you could be sitting and you could grab onto it and kind of pull up.
Well, let me see if this over to the side would help any. Oh, that does help.
Oh, okay. That looks better.
That does look and feels better.
Yeah, that's like kind of like a column. Okay, now your legs might feel a little weak.
Yes.
Okay, so maybe it's something you practice. So like whenever you get out of a chair, I know it's going to be a little tough, but this is what you want to be thinking about practicing. You know what I mean?
Gotcha.
Because it'll reduce the stress on your lower back a lot if you can do it like that.
Just having, let's see.
Oh, could you get a stick?
Oh, I have a walking stick.
I wonder if you can use a walking stick in your hand.
Do you want me to just try that later or go get it?
Go get it now. You're good. But I'm just trying to figure, I mean, the chair is good, okay? But I mean, you're not going to carry the chair around with you, you know?
Can't get to my walking stick, but I found the Swiffer.
Great. Love Swiffers. Just, hey, I will not be responsible if you break the Swiffer, okay?
Yeah, that's right. Hey.
Not as stable.
No, it's just not as good.
You get the concept.
I have to put this chair, I sit over there. I have to put that chair next to this one. I can do that.
You get the concept, okay?
Yes.
The concept is that you have something that kind of helps assist you, but to kind of train your brain to say, all right, I've been getting up for so long, right? Well, you've seen it, like this, right?
Yep.
And these muscles get a lot of work if you have to do that. Okay, because you're doing like a back extension with all the weight of your body, right? And you're straightening up. It's really much more effective if you can use the thighs and the hips to pull through.
Okay.
All right. So use a hip strategy. What you're using and what you've trained yourself to do right now is a back strategy. I just don't think it's going to bode well for what you're describing because you are somewhat extension intolerant, where when you activate or use those muscles too much, it's yucky. They're your yuckiest motions. And yet every time you get up, right, you're replicating that motion.
Right.
The third place where this shows up is just doing everyday chores. And one of them is washing dishes. And so the sink sets in a little bit. You try to belly up, but inevitably you are leading with your head rather than your hips because you have to get in to do what you need to do. Right. And again, if you zoom in, so let's come close if you can. You can see in kind of just static standing when my hips are in line with my head, these muscles are pretty soft and they're not working that hard. But if I lean in, go ahead and push on that. Push on those puppies. My back muscles. Are they hard or are they soft? They're hard. All right. If I do this, what happens? They're squishy. All right. So they're squishy, which means they're sort of shut off, for lack of better terms. They're having to work less hard. They're not as contracted. But when I'm leaned forward, that immediately makes them kind of tense up, again, to prevent me from falling forward because their action is to prevent that motion and keep me upright. And so what do you do about that? Aside from coming up with a new sink design, which I may be working on, you could do this. You could open up the cabinet, make sure obviously there's cabinet support. You can come on in, and now you have sort of another foot in front. So what this does is it sort of aligns your center of mass between these two anchors. And so having your foot underneath causes your back muscles to not have to work as hard. So another chore, I guess you could say the fourth way this might show up, but it could show up again in a gazillion different ways, is when you're using either the Bissell Pro or the Shark, all right? So while you're using maybe a mop or you're using some type of vacuum, all right? And here's what it looks like. So lots of people, again, when they're on a mission and trying to clean the house, what they look like is this. Aha. And what we see is that she is leading with her head rather than her hips. So her back muscles are working really hard. She's got a great reach, right? Getting in all the cracks and crevices, right? And wonderful length. Looks great, okay? But working harder than she has to. So try leading, keeping it closer, leading with the hips, going forward, instead of the head. Is that right? That's perfect. Exactly. Right. And so this is much less effort required of the back muscles of the butt muscles, but it's kind of natural when you're trying to get something done, when you're rushing, when you're not paying attention, you might not even be aware that you're leaning forward. And if you're leaning forward, again, you're making these muscles work even harder. So try to become aware of that. check yourself out when you're doing that. Ask somebody to watch how you're vacuuming and see if this is something you might be doing. Another way where this shows up is when you're working on your computer. How so? Because most people lead with their head rather than their hips. And so what we'll see is that people close off their hip trunk angle. They reduce their hip trunk angle. So let me get to this side. And you can see this is an acute trunk angle. And when that happens, again, you're leading with the hips, not the head. And these muscles, just a wee bit throughout the day, are having to work to hold you up. Because if they didn't work, then your head would hit the keyboard, all right? So this is one way, right? You're very engaged in what you're doing. Or let's just say you're not somebody who works like this, but you believe that you should have good posture because, well, good posture is, well, it's good, right? And so you sit up very tall. And if you sit up very tall, you can see these back muscles are going to have to work a lot more versus what if we were to lead more with the hips rather than the head? What does that look like as it relates to sitting? Well, here's what it looks like. Just kind of chill. And now your hips are in front of your head. Now, granted, you'd either have to have really long arms or you'd have to move everything closer. But assuming this wasn't my daughter's play desk, we could have slid her forward, right? The table could have came into her belly and she could have been working, right? And so this helps open up that hip trunk angle, makes it less acute. She's now leading with her hips in front of her head. Her back muscles are butt muscles, and just everything is less engaged, maximizing the blood supply. Or how about when you're at the kitchen counter trying to cut up strawberries or watermelons or carrots? What happens is we tend to lean into our work. And you can see that if I'm leaning in my work, these muscles are having to work really darn hard. So why not just pull this thing closer, right? Or maybe get on the end of the island where you can put it on the corner and you can be right here while you're cutting it, right? So again, not being lean forward, being aware of being more upright, not leading with the head, leading more with the hips. Give it a try. Another way is, how about if you're out at the garden? So many people, they kneel. They have those little pads down and they find themselves, and it's not too many weeds, but they find themselves weeding, right? Like, oh, I just did it. I just corrected it. They find themselves weeding like this. But what did I just do? What I did is I put, again, like another table leg, right? Imagine I'm a table. These are my two legs, and here's my other legs. And then I took these legs away. Where would the table want to break? It would want to break right here. And so your back and your butt muscles are having to work harder to keep you upright. And so if you're leaning forward as you're weeding like this unsupported, then why not shut off or reduce the load on the back and the butt muscles by putting an arm out there and then switching it if you have to do it. So adding additional support, again, so things are more centered and there's less load through the spine and through the butt. Or how about if you're weed whacking, right? So I find myself sometimes when I'm weed whacking, I'm getting all serious about what I'm doing. And I'm looking like this. I'm really trying to get it done. What happens is you're working harder than you need to. Pull it close, get your hips up. Maybe you change where this handle is, or this is pretty cool. You get creative, you can put this around. And now, the weight of this thing, the distance of the load from the body, how far away it is from your body determines how hard your back muscles are gonna work. So if you're out here, it's really hard, but if you got this thing, then kind of is just dangling. Pretty cool, actually. So think about keeping things close, leading more with the hips than the head. And if you have some other kind of outside the box ways that you can reduce the load of something you're holding in your hands, then by all means, use it. Now, most people cut the grass like this, but you're again leading with your hips, not with your head. So why not pull the lawnmower much closer? These are the handles, all right? Why not pull it much closer to reduce the overall strain on your back and your butt? Now look, there are 1,000,001 other ways that this could show up for you. I'm just trying to kind of help you see how you can apply this concept and how you can start to do some detective work in your own life so you're not constantly leading with your head rather than your hips. And then start to come up with solutions, some of which I shared today, so that you're more aligned, for lack of better terms. When I say alignment, I'm not saying that it's good or it's bad, but the truth is that the more you lead with your head versus your hips, the harder your back and your hip muscles have to work, and that could be contributing to your pain. So try some of these things on. First step, you've got to be aware of this stuff happening, so do the detective work. Second thing, try on the tweaks or change some things in your life so you're leading more with your hips than your head. And then probably number 3, just leave a comment below and let me know if you found this insightful or useful in any way. All right, so that's all I got. Again, my name is Dr. Charlie Johnson, physical therapist. We work with people all around the world dealing with back, butt, and sciatica problems. The goal is to teach people how to heal naturally using the power of their mind and movement as medicine. If you're interested in potentially working together, I'd be happy to review your case and see if we can help and what that might look like. Just click the link below to apply to work with us and follow instructions to submit a case review. Thanks so much.